I have Crohn's disease, and I first noticed that in May 2010.
What did you notice then?
Well, I had my lips were swelling up, and I had a really sore mouth. Even eating a wee bit of chocolate in my mouth would burn, and I thought it was actually wisdom teeth. But the dentist was right on it and says, "No, this isn't your wisdom teeth. Straight to the dental hospital."
Mm-hmm.
And then they referred me to a gastroenterologist because he says it was nothing to do with my mouth. By the end of September, my stools were very runny in the morning. I would go in the morning once, but trying to get away from the toilet that once was quite difficult. I could maybe 3 or 4 times in the space of I was getting up half an hour earlier than what I should have been just to go to the toilet. And there was occasions where I was eating something and less than 6 or 7 hours later I could tell out my stool that it passed through, and that's something's definitely not working in my system here.
So how did you come about the diagnosis of Crohn's disease?
I eventually get referred to the gastroenterologist I mentioned, and I saw him, I think it was about the 30th of December 2010. I went to see him, and he said, "I don't think you're in any immediate danger. I think you've got IBD, irritable bowel disease." Inflammatory bowel disease, sorry. And he said, "I'm going to refer you for an MRI scan." I got my appointment through in the start of the new year 2011 for the end of January, but by which point my dad had taken me up to A&E because I was just not well at all. I was coming back from work and sleeping from 5 o'clock right through till getting up the next day, and they said, "That's just not right." I got admitted to hospital that night because my haemoglobins were rock bottom and my CRP was about 60, 70. He says, "I'm just going to keep you in." And I was in for 2 weeks, and when I got my MRI and a colonoscopy, and that's when I was officially diagnosed with Crohn's disease. I was then put on a course of azathioprine and 50 milligrams for a little while, and then that wasn't working, so they decided it was Humira, which was 1 injection every 2 weeks. Then decided this still wasn't working.
It wasn't working in what way?
My haemoglobins were hanging about 11. The CRP was hanging between 10 and 20. Wasn't coming down. So they decided to hit the panic buttons and double everything. So Dr. Blast suggested that I try homeopathy and not double the medication due to potential side effects.
After you got the homeopathic treatment, how did you get on with that?
The first couple of months, I was much the same. I think it was struggling due to the other conventional medication that I was on.
And did you have any complications from the inflammation?
Well, the hospital didn't really notice that I had inflammation in my terminal ileum, in which I've now got scar tissue in a narrow part, and I was given an MRI. I was told I had to cancel a holiday 2 weeks before I went because he said something wasn't right, so I kept getting what I know as bubbles. My side was coming out, going back in, and I got rushed for an MRI and a stricture in my terminal ileum.
What size?
Well, he says to me afterwards that if I'd eaten a nut, it would possibly have ruptured the terminal ileum.
And how long ago was this?
That would have been nearly 2.5 years.
And how have you been since?
Better and better.
In what way?
Bloods are consistently good. My haemoglobins now sit between 15 and 16, and my CRPs are less than 6. I'm eating a better variety of foods. Bubbles are very rare now. Instead of having maybe 5 bubbles a day, I've maybe got 1 every 3 weeks.
Are there any indications that the stricture is getting better?
Well, before my stools could be pencil-like most of the time, but now I can go and they're very normal. Well, what I deem to be normal.
2.5 years after the treatment, are there any symptoms left of your Crohn's disease?
Just the occasional bubble.